the other folks that aren't here. We also have some people that are on GoToMeeting that are listening to us as well and might be chiming in as well. So part of the GHICC course is the I, which is interprofessional. So can I get a show of hands of the medical students? Okay. Where are my PA students? Okay, I see everybody's just clustered together, aren't they? Okay, don't worry, we'll mix you up. You can sit together now. What about PT? Okay, nice, a nice representation of PT. There's a lot of online. Okay, any OT that are here? No? What about any clinical lab science? Nursing? Yay, one for nursing, representing like your entire discipline here. Graduate school? Okay, anybody that I missed that's here? No? Okay, let's go to the folks that are with us at GoToMeetings. Okay, I hear, oh, uh-oh, I saw nursing. Who else do we have online here? Nursing, physical therapy, lab science, PT. I'm guessing a lot of PT. Yes, a lot of PT. Okay, great. Well, welcome everybody. We appreciate everybody taking the time to be here. I did want to introduce some of the folks that are here today, and I'll hand this over so everyone can introduce themselves here. Stand up and turn around.
Hi everyone, my name is Fede Wally. I'm one of the faculty members with the PA program.
I'm Marcy Contreras, also PA faculty. I'm Jean Smith with the physical therapy faculty.
Carolyn GHICC, physical therapy. Erin Cottis, physical therapy.
Alrighty. And Dr. Dasho is in clinic right now, and he says he has, quote, 100 more patients to see, which I think is a slight exaggeration. But needless to say, I don't think he's going to make it in time. So part of what I wanted to go through today is introduce you to the course, go through the goals and structure, some of the expectations for the course, because sometimes students come in with a certain expectation of what the course is going to be like, and the course itself is a little bit different. And go through some kind of big, hairy ideas, is what we call it, in global health, and then answer any questions. So I wanted to start off with this. How many of you have traveled internationally? Show of hands. Okay, so almost everybody. How many of you have done any global health work already? Okay, of you, keep your hands up, keep your hands up. Keep your hands up if you've done mission trips. Okay, great. And tell me from the folks that have, you could just put your hands down. This isn't going to be like some sort of weird physical challenge. But give me a little sampling of the kind of global health experiences you all have had. Who wants to share?
I've had a procedure done in another country.
You've had a procedure done to you in another country? Okay, so you've been, that does count. You've had intimate experience with with another healthcare system. Okay. Who else?
So I went to Haiti for a week. It was a Christian medical mission, and people would hike like 5 miles a day just to be seen. Sometimes they go to different villages and help people in the trucks, bringing them. Just a really, really good experience and changes your perspective with it.
Right. So medical mission to Haiti. And you said that was for a week?
Yeah.
For a week. Okay. Okay, great. Anybody else?
I went to the Dominican Republic for a week, also with industry, and we worked with many doctors there. We got to use a lot of Spanish and got to, really firsthand.
Okay, great. So mission to Dominican Republic, we're also working with local healthcare providers as well, so it's great. Who else? Give me one more, maybe from this quadrant here.
I went to Peru with UT with full medical training, and we worked with people who are local physicians and translators, and go to small villages throughout the week and just basically like provide our own pharmacy, and then as the students we get to act as a physician and have a physician basically overseeing, so we're able to see a lot more patients.
Okay, and you brought pharmaceuticals as well?
Yeah, make sure he does.
Okay. Okay, great. So many of you have had some sort of experience. Let me also see, because I think a couple of folks chimed in here as well. Oh, no. So when you see a picture like this, and you're looking at this from a global health perspective, what kind of comes to mind in terms of what kind of assumptions do we make about a place like this?
That it's doing fine.
They're doing fine. Okay, what makes you think they're doing fine?
Architecture.
Architecture, okay, so they seem to have infrastructure, right? What else?
The park.
There's a park, so there's green space. I saw a hand up there somewhere. I was imagining a hand. Okay, what else?
Someone said the way that people are gathered.
The way that people are gathered. What does the way that people are gathered, what kind of information does that tell you about health status or about the resources of the country?
It looks like they have time to play, so they're pretty good.
Okay, so it looks like they have some leisure time. What other assumptions do we make based on this picture?
Active community.
Active community. There's a lot of leisure, a lot of rest, people coming together. There's not much danger in that area, that's right. Okay. Anything else that kind of jumps out at you from a global health perspective?
Race
Race, what about race?
seems to be pretty homogenous.
Mm-hmm, yeah, from this picture it seems that everybody probably has the same amount of melanin going on. Okay, so maybe there isn't a ton of diversity here. All right. What about this picture? What comes to mind here?
Poverty.
Yeah, well, it looks like a slum.
It looks like a slum. I heard poverty. Deanna says risk of infection. What else?
Still water, trash.
Poor building structure.
Mm-hmm. Still water, trash, building structure. Why are those things important?
Mosquitoes and vector-borne diseases.
Right. Worry about vector-borne diseases, mosquitoes, a lot of public health infrastructure might be lacking. Worry about hygiene, education as well. What else?
Stress.
Stress? What kind of stress?
The bad type.
The toxic kind? The adverse childhood events kind? Okay. Any other assumptions that we make looking at this?
Quality of life is probably not optimal.
Quality of life is not optimal. Why do you say that?
Well, there's very poor sanitation.
Mhm.
Looks like some very developed area.
Mhm.
Lack of access
Lack of access in what way? Access to what?
to any type of, medical, but any type of community, like he's walking, there's no
transportation.
Right. So
Yeah.
just kind of the basics of the infrastructure, transportation, sewage,
They have
some things.
clothes draped everywhere.
What's that?
They have clothes draped everywhere.
Clothes draped everywhere.
Like electricity, water, equipment, all that house stuff.
Right. All the things that you would do in your house. So part of why we show this and kind of juxtapose these two is really when we think of global health, which one of these pictures are we really thinking about?
Right.
Yeah, the one on the right. But really, this is all global health. There are going to be areas that look very much like this picture on the left that might look a little bit more developed, that might have more infrastructure, but maybe they have a ton of inequality within their cities. There are places that are going to look like the picture on the right, where all you can do is look at it and see all the things that are wrong, right? It's kind of hard for your brain not to do that. You see the trash, you see the sewage, you see so many things. But sometimes when we look at it through our Western lens, we don't see some of the things that are also there, which is that there are these blue bins on the right side. Those are places that are meant to be able to store and filter fresh water to keep water safe. So when we bring our own kind of Western bias and perspective, we obviously have a preference for which one of these we would want to live in and which one of these we think is safer and healthier. Who would prefer to live, if they had a choice of just these two, and you can't alter them in any way, who would choose to live on the left? Okay, who would choose to live on the right? Okay, you're always going to be kind of on your own there. So let's just say 99% of the people here are going to choose to live kind of on the left. And that is going to inform our biases too. Maybe the community on the right might not have the best public health infrastructure, but they do have an infrastructure. Maybe they have great community support systems. So we're hardwired to look to see what's missing, but we also need to see what is actually, what's working. What are the assets that are already there in the communities and need to be cognizant of the biases that we bring. So when we talk about health, we've talked about this in some of the other courses. So I know that at least the medical students have already gotten this. You know, in your individual courses, you know, in PT and OT and lab sciences, we think about health really broadly, right? Not just absence of disease, but really we think about physical health, mental health, social well-being, not just whether someone's sick or not. And I want you to keep that definition of health in mind, because as we go through this course, we're not just going to be talking about health outcomes. When we think about global health as an entity or as a study, I really like this one, which is it's an area for study, research, and practice that places a priority on improving health and achieving health equity for all people worldwide. And you're going to hear that word equity quite a bit. So we can dig into that a little bit more. Equity is the absence of avoidable or remediable differences among groups of people, whether those groups are defined socially, economically, demographically, or geographically. Now, I'm sure many of you have seen this, and this is a really great depiction of kind of the difference between what equality is and what equity is. Equality is kind of more focused on, do you have the, if we're thinking about something like education, equality would be, okay, everybody gets an education. Equity would be that education being tailored to the specific needs of the individual. And when we're talking about global health and we're talking about equity, that means that there are certain populations or certain people that are going to have different interventions or approaches. So there are lots of different ways to also think about health. We think about health on an individual level with kind of the patient in front of us, and all of our individual disciplines here are going to be geared towards that individual approach. You can also look at it on a population kind of public health level. What we're going to do is we're going to try to look at it at those levels, but we want to try to get to that higher level, which is looking at the root causes of these things. And that's going to require us to look at policy, to look at economics, to look at history, to look at why inequity exists to begin with. Part of, and you don't have to read all this, but part of what I find so fascinating about global health itself is that it really is multidisciplinary. You can't look at it from one angle. You have to look at it from multiple different angles. There's no one field of study or one discipline that knows how to do global health. So even though we're all going to be future healthcare workers, it's important that we bring in political science, so we bring in economics, so we bring in social science to be able to inform like how we think about global health. So I want to kind of illustrate this a little bit with a situation that maybe some of you have already found yourself in. So imagine that you're on a mission trip to Batay in the Dominican Republic. And Batays, I know some of you guys already know, but they're communities of mostly migrant Haitian workers that work on sugarcane plantations. You're seeing a mother and a 2-year-old child, both of whom look pretty malnourished. You measure the child's weight-height ratio, upper arm circumference, both of which are under the 10th percentile. You have a Creole translator who's able to work with you, and she tells you that the child has been coughing, doesn't want to eat. She wants you to give her some sort of pill because the mission group that came before you a few months ago gave her some pills, and she wants some pills to make this cough better. So how do you respond to that? What do you guys think?
I would reassure that we're here to help. You know, if the child does require medications, we're going to make sure that if we have them in stock, that we'll give out what's appropriate. And then I would let her know that we just need to continue to look at exactly what's wrong with her child.
Mm-hmm. And I saw also that one of the students on the group meet had said that they're not from the previous group, but that they would, but will do what I know best to do. Okay. What can you actually do in this position? So those of you that have already done some global health work, kind of prior to being students engaged in this discipline, or at least you're training to become a healthcare worker, I'm sure you've been in these kinds of situations. What can you actually do in that position?
First, ensure that whatever the course of action is to improve their health, and just talk to the doctor about it.
So be able to defer to the doctor, get whatever history you can, talk to the healthcare worker you're working with, relate the symptoms, and try to come up with a plan. Has anybody been in this situation where you're there really isn't a healthcare worker, and it is just you? How many of you have ever been in that situation? Yeah, what do you do? Anybody want to share kind of what they did or felt in that situation?
The only thing we could do, we had a bunch of baby food, and it was like a whole family that was very malnourished. So we gave them as much as we could and gave them the medicine that they needed, but we were only there for a week, and so there wasn't much we could do because we came with our own healthcare workers and we weren't really working with doctors there.
Okay. So you were able to provide some food. how long did that food go? Like, how long would that have fed that family for?
Probably
Okay. Weeks, maybe?
a couple.
A couple of weeks? Okay. Okay.
We share the text.
Oh, good. We have something else. Mhm. No. Just be honest with them and let them know if you don't have the answers, you'll find someone that can help. Okay. Okay, great. And I have not, but I would let them know. I'll find out and get back to them. Okay. What would need to happen in order for these two individuals to achieve a good health outcome? What do you guys think? So now you're not just looking at it from the perspective of what you can physically do for them, but what would need to happen in their life circumstances and everything going on with them that would actually ensure that they could have a long, healthy life with good quality of life?
Trying to find a way to make it so that they can manage their care once the group's gone. So maybe partnering with local physicians or medical practices to maybe treat the root cause of what it is.
Yeah. So instead of just kind of putting a Band-Aid on it, trying to figure out what the underlying causes, and partnering with local communities or organizations, and really thinking about sustainability there of after you're gone, what's going to happen to them. Okay, I saw another hand.
I wonder if it's like our responsibility to research what's around their community. So like telling them what the best that you know, like this is here. So after we leave or something like this happens here, you can go here. Usually these people will help you to move to this facility.
Right. So linking them with resources in their own community that maybe they didn't even know were there. Right. That can provide ongoing care. I saw another hand over here somewhere. Any other thoughts? What else can we do?
Get someone more experienced than us to help.
Get someone more experienced than you to help? Phone a friend?
Educate them like on what to do now, just like you have a certain skill that you see
Right.
that can be applicable in the area, and you can teach them that way, or you can teach them certain like management or nutrition things. If there's a way for you to communicate it to them, you can say this is, you know, if there's proteins in your area, focus on eating that to try and help them up.
Right. So be able to educate them on kind of with the knowledge that you do have at the stage of competence that you are at, using kind of locally available foods and resources. One of the things that I think occupational therapy does incredibly well is to really utilize what the resources are and to be able to work with what the goals are of individuals. So I think when we think about what needs to happen in order for individuals to be able to have a productive, healthy life with a good quality of life, all of a sudden our interventions for global health really change. It's not just about providing something short term. It's really thinking not only short term, because that's going to happen, we're going to need that, but also thinking long term as well. Part of what we want to do is to be able to equip you all with just a little bit of paradigm shift in the way that you're thinking through these things so that you can be creative in how you can help these populations. Part of what we want to do is give you the opportunity to explore some big concepts in global health, and our whole mission is concepts over content. You're not going to need to take notes. There's no test. It's really, we want you to be engaged. We want you to be able to kind of bring your own kind of thoughts and life experience as well and challenge your underlying assumptions. The objectives for the course itself are going to be to explore global health in the setting of looking at it from the perspective of international development, from a foreign aid, from politics, and also be able to identify some just the basic principles of public health, social determinants, and inequities in health. How many of you already have MPHs or public health degrees? One. Okay, so that's probably going to be your photo friend right over there. We also want to bring in different frameworks and different ways of thinking about global health, from human rights to ethics, and think very deliberately about our actions. We want you to be able to reflect on your own biases and beliefs and how they impact not only our motivations for doing global health, but about our impact, and be very critical of our of the kind of interventions that we do in the sphere of global health. We also want students to be able to take a cultural humility approach, where we're not walking into a situation with the answer of this is what we're going to do, but we're working with communities to set an agenda, and we're learning from them as well. And our curriculum is really not based on just something that we dreamt of. They're based on competencies developed by CUGH, which is our consortium of universities for global health. And by the end of this global health core course, you guys are expected to reach the global citizen level. There are many others, and the MPH folks are probably already beyond this. Whoops. And these are the 11 domains of competencies that you guys can look at later. We're going to be meeting in smaller groups, and what we'll do is we'll take all of the students, we'll make sure that we have smaller groups that are interprofessional, so that it's not all of the medical students in one group and all the PA students in another group. We know how everyone likes to sit with their own profession, so we're going to break that up and make sure that you all get to know each other and that it's truly interprofessional. You're going to be meeting with your group once a month, and for 2 hours. It's going to be about 20 to 30 students, and it's going to be on Wednesdays at Mary Moody Northern at 1.102 from 5 to 7 p.m. And no one is excited about 5 to 7 p.m. I know most of you and us are going to be brain dead during this time. We recognize that, okay? And all of you will realize I get very frontal during that time. But this is actually the only time that we have been able to identify that all of your schedules align. We've considered doing it during lunchtime hours, we've considered doing it some other times, but the only time we can get a group like this in many different schools together is around this time. So 5 to 7, it's once a month that you're going to be meeting with your small groups, and you're going to stay in your small groups for the year. The small groups aren't just going to be us talking. They're going to be kind of a mix of a little bit of lecture with a lot of small group activities, and a lot of it is going to be led by you in the discussions that you have in your groups. A lot of the scenarios are going to be applicable across disciplines, whether you're a DT or PA, it doesn't really matter. And you'll have faculty facilitators from different disciplines as well. And one of the things that I think has been really important for our students, and something they keep asking for every year, is even more opportunities to be in interprofessional environments and groups. So you're going to meet once a month with your assigned group. Attendance is required. These are going to be some of the main topics that we're going to hit on every month. So our first session is going to be on international development, then international aid and humanitarian assistance, human rights and social justice, public health approach, the public health metrics, health systems, human resources for health and social determinants of health, and then medical volunteerism and cultural humility. These are all the folks that are on our interprofessional advisory board, and I really need to amend this to add some new folks that we have in the room today. In terms of expectations, we understand that this is not the only class that you're taking, and we don't want this to be overly burdensome for anybody. There are going to be weeks where you're going to have GHICC on the week of a test. It is 2 hours. If you cannot spare 2 hours the week of an exam, we need to talk about other issues and approaches to studying. It's just 2 hours. Sometimes it's going to be the day before an exam. Sometimes it's going to come at an inconvenient time. The only actual exception is for the students that have required class activities. So if they have practicals, if they have OSCEs, if they have anything like that. So for that, we do make exceptions, but please plan accordingly. And all that we really require is for you to show up. That's it. Show up, be engaged, be ready to engage your colleagues in discussion. Some of the sessions that are a little bit later do require some vulnerability, which your medical students know I'm all about. So, we want to hear from you. We want to know what you think. We want to know, based on your life, we want you to bring your life experience and all of you into this course. Because the best discussions we've had are the discussions where the students bring their own experience to bear on the discussions. So a little bit about what this course is not. We're not going to teach you how to do we're not going to teach you how to put in an airway with a big pen. We're not going to teach you how to make a splint out of twigs. It's not a practical skills course. Many of you are just starting your journey on what it is to be a doctor, what it is to be a PT, and you're still learning that. So this is not going to be like a hands-on, I'm going to learn how to do a lumbar puncture with a straw kind of course. So if that's the expectation, you should probably withdraw now. It's also the only devices that we have, and when you are on your devices are when you're actively looking something up. Aside from that, you put your devices away. It's also not right now about what your profession does in global health. That might evolve as our advisory board and faculty have more discussions. But right now, we want you to focus on the key concepts. It's also not a good time to catch up on other work, studying, doing Anki flashcards, or social media. It's not a class where you can just sit back, put your feet up, and snooze your brain, or a class that is going to be like a one-stop shop. The requirements for GHICC are going to be different depending on your school and your, so check with your faculty for exactly what your requirements are. For School of Medicine, for the medical students, you need to attend all the sessions. There are no more than 2 absences, and session 6 is absolutely mandatory. There's also a requirement for 20 hours of community service that gets uploaded onto Blackboard. And for everybody, there is an interprofessional community service video that we're going to do at the very end. And this is what we're doing. It's an assignment / contest. We basically will donate money to a foundation or to an organization that your group decides to donate to, and you get to decide. So that's the contest piece of it. So everyone, when you're divided into your interprofessional groups and teams, get together, create a video reflecting on your group's kind of combined experiences during the year. And then we select the student videos on the final sessions. It can't be longer than 10 minutes. They have to address the following. How did something you learned during GHICC apply to your local community service or patient population? How will you integrate this knowledge in global or local work in the future? How did the service experience impact you personally and professionally? And then we want you to reflect on your experience as part of working with an interprofessional team. So that's something you're going to do outside of class, on your own, and that's also going to force you to get to know your other team members. We have all of our assignments and PowerPoints on Blackboard. The syllabus is on there. Review it carefully. It has all the dates that you need. We do have a monthly assignment that's due on Blackboard no later than 12 p.m. the day of your small group. And what it is you basically submit an article or a link of an article that's current events based, that's related to your profession and the global health topic for that month. So an example would be nurses working with human trafficking victims in Thailand for our human rights module. And I know it's difficult for some students to kind of find some of these articles or some of these content, but we've had many students be able to find these things for as long as we've been doing this. We also post our PowerPoints on there after the sessions, and we have some suggested additional readings for anybody that wants to delve a little bit further, and links to kind of current day events as well. We put our announcements on there, and you can also post your community service hours on there as well. Okay, so here are some of our big ideas. Is one part of what we're doing with GHICC is learning a common language. Global health has a language, just like PT has a language, just like medicine has a language, and part of this is going to be all of us being able to speak and learn that same language. The other thing is that none of this is anything you're going to be tested on. It's really, yeah. Is that a high five? Yeah, thumbs up. But we do want you to show up, and we want you to be engaged. And part of this is really being able to learn from one another, and to be able to take lead, to have our thoughts and our opinions be guided by the data of wherever the data takes us. There's also, for a lot of things, no right answer. We have a lot of students come to us, a lot of times after the health systems module, and they ask, okay, well, just tell me what the best health system is. And if there's no kind of multiple choice right answer for that. So there are a lot of kind of topics where there isn't going to be a right answer, and so it requires you to debate and to be able to look at the context. And we don't want you all to feel useless. You're here because you obviously want to help people. And if you don't, you're really in the wrong place. You're also here because you're interested in global health. And we want to be able to equip you with some tools that'll help you think strategically about what kind of impact you can and cannot make. And help you be able to make those kinds of choices with your global health career in the future. Let me see this. Also, a lot of what we're going to be talking about is not just limited to global health. It's also applicable locally. We have poverty in Galveston, Texas. You don't have to go very far to be able to see these huge global issues locally. So we want to be able to make sure to make that link for you. And I think, above all, this is a fundamental question, which is, what is the kind of world we want to live in? And what are we doing to advance that vision, individually, collectively, as a school, as a nation, as a world? And what is our impact going to be? What is your impact going to be as a student, as a future healthcare worker? And what does that look like? We do have a listing of global health activities at UTMB. There's a website there. We also have Global Health at UTMB PowerPoint on Blackboard for this course. There is a Facebook site, I am told. And we also have announcements, so sign up for your group. We do, actually this doesn't matter because we're going to go ahead and change your groups anyway. So if you haven't signed in, before you leave, go ahead and sign in. That's going to count as your attendance for being here today. And we're going to go ahead and assign you groups. And we'll email that out to you in the pre-course survey tomorrow. There are a couple of things going on campus that are global health related that we're going to let you know about. One is on October 12th is our Global Health Symposium, which we have every year, and it is on One Health. It is a Saturday, but registration is free if you use this code MS12023, and it'll be on the PowerPoint on Blackboard as well. So I highly encourage you guys to attend if you can, especially because a lot of the work that our previous global health students did from last year is going to be presented here. So it gives you a really great idea of what they did, what kind of projects they worked on, and what kind of global health experience they were able to get. The other big conference is in December. December 9th and 10th. This is a Health and Migrants Conference, also at UTMB. The website is right there to be able to register. And we actually need volunteers to be scribes, volunteers even to facilitate certain sessions. So if you're interested, we can get free registration for you guys for that. Email Dr. Hanny Sarag at HASERAG@utmb.edu if you're interested.
Do you know volunteers still have to pay the registration fee?
Volunteers do not have to pay the registration fee. All right. Okay. So we're going to play a game called Global or Local. Everybody has to play, okay? I'm going to show you some pictures, and I want you to tell me if you think it's outside the U.S. or within the U.S. Okay, is this global or local? Global. Okay. Does anybody know where this is at? I heard Central America. Anywhere else? Guatemala City. Where else? I thought I heard it. Very close. This is Venezuela. Okay. Global or local? Local. Okay, here's some global. Okay, where is this? Anybody know? Galveston. This is not Galveston. I'm assuming you guys haven't driven up and down the streets enough to know. Anybody else?
Like United States-Mexico border.
Okay, U.S.-Mexico border.
Paso.
Houston, El Paso. This is the Colonias, Rio Grande Valley. Okay. What about this? Global or local? Local? Okay. Where is this? Does anybody know where this is? Local? Did someone say Lubbock, or did I just hear that? No? Midwest. Okay. This is Fort Worth. Shantytown in Fort Worth. Okay. Global or local? Global. Does anybody know where this is at? China, Asia. Any other takers? Okay. This is in Kenya. in Canberra. Okay, global or local? Local, where is this? Dallas? Where else? New York? Nashville? This is Galveston. Detroit, that was a good guess too. So I'm done with kind of the introduction for the course. Are there any questions about the course itself?
So I know a lot of us come from our anatomy lab right before this that ends at 5. Is it okay that we're a little bit late, kind of getting changed cleaned up?
Yeah, no, we understand that you guys are going to be, you're going to smell a little funky and you're going to come in a little late. That's okay. Any other questions?
So, those who like coming to get the intro for like signing up for the credit, is there going to be a late fee attached to it, or can we still sign up?
Which, your PA or which PT? Do you know? You can still sign up. Any other questions?
For small group divisions, like, will it matter if we're from the global health track or community engagement track?
No, it doesn't matter either way.
When is that deadline to sign up for PT?
Deadline to sign up for PT?
It's probably with the registrar and my late fee.
Okay. Probably with the registrar. We're not quite sure.
I think the PA students still aren't in your Blackboard group. I don't know if you all have if you can add in what to do.
I don't think anybody right now is really in the Blackboard group yet. So once you sign in today, we'll make sure that everybody gets into Blackboard.
Okay, when the course is gonna be on Blackboard.
Ron, do you know when Blackboard's going to be active for them?
Make sure you sign in today and register for a small group. I'm going to have to sort them based on the profession. So if all the PAs are all in one group, I'm going to have to separate them so that we have a good mix in each group. I'll let you know what group that you're assigned to probably by the latest on Friday, because the classes start Wednesday next week. You'll know which small group you're in. You'll know you have a schedule and syllabus attached to that email, and you'll also be registered for the Blackboard course. I'll also be sending out a 3-course survey, so take that before you come to your first session. Other than that, if you have any questions, you can email me directly.
So by the way, this is Brad Rock, who is our Rockstar coordinator extraordinaire. And so all kinds of logistics questions are going to go to him. Any of the logistics questions, well, we have him here. You know, any other questions in general? Oh, okay. Let's see. Will the Bridge PT students be assigned to groups? No. All right, so I'll be here for a couple more minutes if anybody wants to chat about anything. Thank you all for being here. We're really excited about this class. And please sign in so we can distribute the groups, okay? Thanks so much. Please.
Have y'all worked out the MPH?